For my friends, family, esteemed colleagues, it was brought to my attention that although mentioning prostate problems whenever I'm talking about toxic blood and inflammation, that I did not write a specific article and probably not even video about problems of prostate enlargement and other prostate problems. So let's remedy this. If we ask our specialists what causes enlarged prostate, well, this is a big question mark, because it can be caused by factors, again, through statistics. We know, well, there are some hormonal changes, often, not always, present with enlarged prostate. Or if we look at hormonal changes and reflection of our health, then we will notice that often enlarged prostate occurs. So again, we go by statistics, because if you don't understand problem, then you go checking out when does it occur frequently. And this is why we say, well, enlarged prostate is occurring more in older people, 50 plus, 50 years plus. And I just had a client yesterday that was jabbed 4 times, and 70-year-old young man, still surviving even the 4th jab, and has some prostate issues, but not terrible. Little strenuous urination, but doctor told him, well, your prostate is in a 3rd phase, which does not require any action, but you know, the standard of watch your diet, eat more fruits, more fiber, which means more vegetables, all the standard misunderstanding and lies that parents are just regurgitating. And then when it goes, but this is normal for you, this is where it normally, stage in which prostate normally occurs in your age, 50 plus. Well, this is bull, as we know. So, what is causing enlarged prostate? And what are the signs of enlarged prostate? We can see hormonal changes, you know, and we always blame this as a contributing factor to a problem. So, what else do we see? Age. Okay, so hormonal, age, and we go to check also, how are your relatives? Do they have this problem? How are your father, grandfather? Oh, you see, genetically you are already programmed for this to happen. So all the usual suspects always are in play. So the problem here is not hormonal change, problem is not your genetic ancestry. The problem is, as I mentioned always, toxic blood. How can toxic blood increase size of a prostate? Well, simply when you have tissue, let's use skin. If you have a irritation, toxic irritation, the cells will not hydrate. So they basically cringe, make the membrane smaller. There is no cleansing going on of the cells. They become more acidic. They expose this acid with water, so they become dehydrated since they do not hydrate. And overall, the cell becomes so toxic that, again, it is triggered into proliferation. Simply packing the most garbage on one side and dividing a cell with a membrane, so it tries to achieve higher voltage, increase the voltage, hold the voltage better with less toxic blood of the part of the cell that is continuing, and the other part should be destroyed, but it doesn't get destroyed. Why it doesn't get destroyed? Because it's not labeled for destruction. GCMF is missing. And now if you have a tissue, like let's say skin, which it continues being irritated, toxic blood is coming, toxins are coming. It's not hydrating on cellular level, but it's forced to perform. So it needs to produce, secrete cholesterol, it needs to release water because through evaporation it is cooling the body. So what is happening? Because it's being forced to perform in toxic environment, there is more and more proliferation happening, and the skin is becoming thicker. Also, it is forced to handle liquids, being it toxic plasma, being it water for evaporation. So the cells in charge of this increase in size and in number. And this creates a thicker skin. Same thing is happening with the prostate. Prostate is being used as to produce lubricant during sexual intercourse. And this is why when we have a man that is sexually active but toxic, blood is toxic, cells are toxic. Well, the cells of prostate are forced to create mucus as a lubricant, but they are dehydrated. So through forced hydration, which we call inflammation, cell is receiving the water that it can then use to create mucus. And because it's not hydrating regularly through osmosis, because it does not want to absorb the toxic blood, it is being forced to absorb the blood by increased pressure of the tissue. So the prostate starts increasing for two reasons. One is inflammation, because it's becoming inflamed chronically. And another one is increased proliferation. Now it is still receiving the electric charge from a heart. It's being plugged in. So It receives the energy, although the cells cannot hold the energy, but it is being supplied constantly. So this proliferation is controlled proliferation. You know, it's not happening one after the other uncontrollably. It's just when toxicity increases so much that cell has a problem, it separates, pop, and now the other part, but this separated part is not being taken apart because it's not being labeled with GCMF. Macrophage has no idea that this should be done. So it lingers there. So you have now doubled on the cells. The whole tissue of prostate is increasing in size. This is the same thing what happens with thyroid. Exactly the same process. Increased thyroid, increased glands, lymph nodes. It's always the same process. So now, as prostate increases, it increases increases pressure on urethra that is going in between. Putting pressure on it, it decreases its orifice, so it makes obstruction of passing urine. So we have a problem urinating. And the pressure may cause pressure on a sensory part of the sphincter that opens urethra. So we may feel, oh, I have to urinate because my bladder is full. It's not, and bladder could be empty. You may just urinate, you finish urinating, you sit down and you feel, oh, I have to urinate again. Well, the bladder is empty because of the increased pressure, because of increased size of a prostate. So I'm not going to go into symptoms of increased prostate much, because you can read about it. There are a million articles on it. Just open YouTube. But the reasons why it happens, well, you don't find any concrete reason. Well, I'm now telling you why this is happening. So, toxic blood, again, is in play. Toxicity of the blood will trigger toxicity on a cellular level because of prevention of hydration, buildup of acidity, and organ that is forced to perform is going to be more affected. So more frequently you are having sexual intercourse, more mucus, more lubricant prostate has to produce, and if blood is toxic and cells are acidic, inflammation occurs faster and becomes stronger, and prostate grows because of the proliferation problem and inflammation problem. Now, are we in risk? Or now they have devised also test of inflammation protein. If it's being PSI, if it's being detected, oh, you have enlarged prostate, well, this is a problem because you may get cancer. Well, we know it's proliferation there, but it's not getting out of hand. It's just enlarging the overall size because we have a lot of proliferated, basically non-active cells, bags, garbage bags, packed there, which are not taken away because they are not labeled. So macrophage has no clue that it should take them out. Why is that happening? Because we eat carbohydrates. And I explained that, how carbohydrate, how glucose is changing genetic expression of our body. And because of influence of glucose, cells stop producing GCMF because they have to start producing nagalas. And it's the same naga gene in different vibration that gives instruction to the cell what to do. So it cannot do two things at the same time. It vibrates either instructing one thing or instructing other thing. So now, how does this enlarged prostate become a cancer? This I have explained when I was talking about cancer itself. Cancer is when you deprive, when you unplug the organ from the energy socket. So, how do you unplug it? By broadcasting, by thinking, creating the particular frequency of that organ as a thought and transmitting it. Now, which thought? Well, just to refresh a little bit the memory, if you start transmitting frequency of thought that is resonating with the same frequency of the affected organ, then the energy that heart produces, instead of in this particular frequency being rooted in that organ, it is being transmitted in a form of thought. So basically your organ is unplugged. It's not receiving energy from the heart, and since cells are being acidic and toxic, they cannot hold energy that they had. Voltage drops. Drop voltage, when it comes below, approaching half or below half of its normal value, so it goes to 0.7 volts, bingo, proliferation. Cell starts again proliferating. And since it's being unplugged, the cleaner part of the cell still cannot raise the voltage, proliferates again. And now we are going into uncontrolled proliferation and resulting in what we called tumor or cancer. Now, this means that as long as you do not waste energy in this particular frequency on broadcasting, and you allow it to properly charge your organ, doesn't matter how dehydrated and how proliferated and inflamed the prostate is, it is not going to be cancerous. It is going to become cancerous when you unplug it, when you stop giving it energy from your heart. And brain is the reason, because it's transmitting. Now, what could be the frequency that is resonating similar or identical to your prostate? Anything connected with sex. Very often, when your blood is polluted in this matter, again, it's not only your prostate that is affected, it's every cell in your body. And one of the most affected will be cells which are closely related to the blood. And this is your plumbing. Not only plumbing of kidneys and urine, but also blood, your blood vessels. And when your blood vessels do not perform well, you are going to have problem with erection. So very often when you have problem with prostate, you already have a problem with erection, because problem with erection usually come before problems of prostate. And then people go, again, getting Viagra, increasing blood pressure in the area, instead of healing, because, again, nobody knows about healing. Doctor knows the least. So when we have a problem with erection, then depression may set in. Because for men, not having erection, this is a big taboo. Not being able to satisfy a woman has not only to do with that, but with personal ego. And when you start thinking about this, when you start feeling, oh, what will happen if I cannot get it up? And you start getting preoccupied with it. Well, this is the frequency that resonates with your sexual organs, your sexual energy. Prostate will be affected. Another one is a deprivation of sex. Let's say you are married and your wife loses interest in sex. And now you are obsessed with this. Men in general, they would love to have sex every day, 2 or 3 times a day if possible. Women are different. And very often, man does not get satisfied. And then, again, depression may set in. Thinking, oh, maybe she doesn't love me, maybe she has somebody else, and relating to a sexual intercourse, bingo! Again, it's a frequency you are broadcasting that has something to do with a sex. It will affect your sexual organs. One of them is prostate. But it will affect negatively also basically your muscles, your connective tissue. So you will not be able to contract and make compression of the vein, and you cannot create erection. So it affects you in different ways, but it is the same thought. Something to do with the sex. Wanting it, not being able having it. For whatever reason. And if that bothers you a lot, and if you spend a lot of time to thinking about it, being aggravated, well, whenever you are thinking about it, you are transmitting. The more aggravated you are, the more you are transmitting, and less energy is going to be channeled down to your sexual organs, and they will be affected more. And proliferation continues and continues, because now it is not receiving the necessary voltage to stop proliferating, and there is a cancer. And then once when it happens, then another thought sets in. Wow, I'm going to die because this is what happens. Mostly because doctors create it. Treatment for cancer is actually more poisoning, terrible poisoning of the body. So more cancer is going to happen. And the thought about dying now is affecting your bones. And it spreads in a bone. It is not spreading, you are causing it with now creating another thought that is now relating to your structure of your body, which is skeleton, and to the area which is already being affected with high acidity and dehydration because of its activity. It's the pelvic wall. So pelvis is going to be affected. When I talk about cancer, I explain that cancer doesn't spread, that one cell now goes and embeds itself in different place and create cancer there. Because And whenever we want to know the truth, we have to go quantum. We have to go back into essence. And then we realize that each part of the body has different frequency. So a cell that vibrates with a frequency of prostate is not going to be able to create a bone cancer, forcing the bone cells to proliferate because they are on different frequency. It's impossible. But the bone cell can turn cancerogenous, means it will go into uncontrollable proliferation because of lack of voltage. Brain. Cancer, every cancer, is deprivation of electric charge, unplugging the organ or tissue from the socket, heart socket, by transmitting that frequency of that organ. And this is why Dr. Hammer was one of them, but way before Dr. Hammer, it was known how psychic, how your thoughts are influencing problems in the body in cancers. Different thought is related to different organ, and if you harbor it, and your body is dehydrated and toxic on a cellular level, the proliferation becomes uncontrollable and tumor, cancer is created. So cancer is an animal on its own, and having enlarged prostate has nothing to do with cancer. And doctors know that enlarged prostate can turn cancerogenous, but not necessarily, doesn't have to. They just don't understand why and how to go about it. And all your treatments are symptomatic. So first, let's get down the inflammation. Alpha blockers or alpha beta blockers. They relax tissue. They decrease the pressure of the blood in the area. So they make less pressure. They shrink the prostate a little bit. No inflammation. But that only works to a certain point. And then medication has to be increased or changed in something more drastic, more dramatic, more toxic, unless you start healing process. And healing process cannot be focusing on a prostate. You are focusing on a blood. You have to cleanse the blood. After blood is cleansed, and you are not bringing toxic elements through your food, making it again toxic to your cells. So if you're eating correctly and hydrating, you're allowing cleansing, then your blood becomes clean enough that cells can relax, increase size of their membranes, start flooding out the toxins, increasing the hydration, and then start activating their cellular pumps at night usually, and hydrating on mechanical level and expulsing the toxins. You will be cleaning the cells. Clean cell can re-establish the proper voltage, holding on to the voltage. Even if you are broadcasting, you are holding the voltage because you have proper acidity of the cell, not overly acidic. You stop proliferating. There is no way you can get cancer. Inflammation stops because there is no forced hydration is necessary, and prostate shrinks. I have mentioned several times before that father of my wife, when a 74-year-old had his medical checkout, the doctor was surprised, telling him that he has a prostate of 35-year-old. So how can 74-year-old men have abnormal prostate? Because it's not in the stage of 3, it's in stage 1. It's normal. Because age has absolutely nothing to do with this. It's all about toxicity. Toxicity and then activity that we have. If you are not sexually active, you are not producing lubricant, so the organ is basically dormant. It is not going to show any proliferation. It is not going to show any problems, even when it's toxic. This is why, for example, cysts in ovaries of women, if they were occurring while she was menstruating, once when she is in menopause, which means now this reproductive system is not active anymore, all of a sudden cysts go away, because it's much less activity, so much less harm comes from toxic blood. It doesn't have to produce any mucus lubrication, not much maintenance, so things calm down. We say, oh, hormonal change. Well, hormonal change is just expression of how body functions to achieve what has to be done. But the triggers for this is the energetic state of the body, vibratory state, voltage. It's all physics, zilch chemistry. So if you have an enlarged prostate, I'm not saying abstinence of sex, this is stupid, but cleanse your blood, self-healers protocol. Start drinking plasma, start cleansing. Of course, you are opening a can of worms, because you cannot just focus on detox of a prostate. It's a general detox. You are working on a cellular level. So if you are overly toxic, and all these people are when you have this chronic issue, this is why I always point out, if you have a chronic issue and you want to use self-healers protocol for healing, be guided, because symptoms, strong symptoms of toxicity, toxic blood and detox are going to show up. We call them flu. But because we are changing things in a way contrary to everything we have ever been told, instead of not having salt, we are now tripling, quadrupling, quintupling salt. As soon as we feel a little problem, salt doesn't agree with me. No, this salt is a problem. Oh, it's fat increase. I'm not supposed to eat fat. I'm supposed to eat plants. You know, this fault programming is in your way, causing fear. Fear draws your energy. Pow, you cannot heal. You have to be guided through the process. Well, some people manage to do it. They simply resonate. They have awakened. So when they hear something that's truthful, they immediately resonate. They understand it immediately. And they have no problem following self-healers protocol without guidance. But unfortunately, very few people are awake. But because the system is not working, because they are getting sicker and sicker under doctor's care, they are searching for different sources of information, but it is very difficult to accept them because of the programming that we have been loaded with through our schooling and through our religion and through the media. It's all pumping into us wrong information that we then use to try to explain our symptoms. And of course we are always in fear, because We have wrong information. So accept the guidance. If you are French speaking and you would like consultation with somebody in French, well, let me know. There are several doctors and healers, people who have been through the protocols to understand it, and they speak the language. They can heal you. They can guide you. In German also, there are some people that I know that can help you then with this. If you speak English, Croatian, Spanish, I can communicate with you this way. Of course, we have now translators, so I'm helping Italian people and people from Kazakhstan and Macedonia. We translate through translator, through emails. But accept guidance to get the fear out, because it prevents you from healing. I see this very often, and even with my guidance very often happens, especially with vegans, because they are so much, and vegetarians, they're so much afraid of fat and meat, and they are very reluctantly change the diet, and then everything that happened, oh, I'm so bloated, I'm having too much salt, can I dilute it with a little bit of water? You can never have too much salt, because you have internal regulator, your genes. You are being adjusted to certain levels of certain minerals and acids and whatever there is. If you go over it, you have a systems of eliminating them. You can never overload on plasma so you blow up because you drank too much. You blow up because your system is toxic and doesn't work correctly and has to detoxify. So these are the glitches. Less toxic you are, less inflamed you will be, less water retention you will have. Has nothing to do. You always eliminate surplus. You cannot overfill a glass. Well, overfill. You cannot pressurize the glass by putting water in it, because it will flow out. Unless you have some cover on it and under pressure you start squeezing. Well, that's a different situation. You are not doing this. You are not connected to a hose with water and being pumped under pressure through you and then tie up your elimination system so the water accumulates. You are not doing that. You are drinking and the surplus is flowing out. And surplus of minerals and water is going to flow out. And surplus of minerals actually then puts the body in a vibratory mode of cleansing, which then eliminates other toxins, not only the minerals. This is the best way to detoxify, and only healthy way to do it. Unfortunately, we have not been told this, because even the alternative medicine is based on the corrupt science, so it cannot advance. You have a prostate problems, self-healers protocol. Again, like with every other chronic problem, self-healers protocol is going to take care of it. Thank you for listening. Till next time, love you much. Namaste.